Anorexia nervosa is an emotional disorder which is characterized by an obsessive desire to lose weight by refusing to eat. The key indicators of anorexia nervosa are a low body weight, and the patient will have a poor body image and they will think that they are larger than they actually are. It has a greater occurrence in females as opposed to males, at a ratio of 10 to 1, so 10 females to every 1 male. Now, for the risk factors associated with anorexia nervosa, there have been studies to indicate that genetics play a large role in the prevalence of the disease. Other risk factors include psychological causes and cultural reasons. Some key indicators in the diagnosis of anorexia nervosa: the patient is having a very intense fear of gaining weight, and they refuse to eat more because they will put on weight. If they are female, they may also present with amenorrhea, which is a missed period. So in the case of anorexia, up to 3 missed periods is a sign of anorexia. You can make some laboratory tests to help with the diagnosis of anorexia nervosa. So you can test for growth hormone, which will be high because of low carbohydrate intake. Cortisol levels can also be checked, so they'll normally be high, or they could also be normal as well, but in some cases they're high. Prolactin levels can also be checked, so they are usually reduced or lower at night, but not during the day. So if the patient has lower levels of prolactin during the day, it is a sign of anorexia nervosa. You can also check for follicle stimulating hormone and luteinizing hormone, and they may also be reduced. And you can also do a thyroid function test. The reason the thyroid function test is important is because patients with anorexia nervosa, some of them have atrophy of the thyroid, so a thyroid function test is very important to help diagnose anorexia nervosa. So if this was the case, the patient would present with lower T3 levels. The treatment or management of anorexia nervosa, the first method is cognitive behavioral therapy. So this is the main psychological therapy in anorexia treatment. The second is to manage the weight gain. So this can either be when the patient is in the hospital or an outpatient. The patient is required to eat calories based on their body mass to gain weight, and the aim is 0.5 to 1 kilogram of weight gain per week. It's important to note that anorexia has many implications on the human body. It's a form of chronic malnutrition. So there's been many cases of sudden cardiac death. Even though the cause is unknown, it has been linked to anorexia because of the structural and functional changes which anorexia causes to the heart because of malnutrition. There are other dangers as well of anorexia nervosa. Some of them include having low blood pressure. There are chronic changes to the heart. You can also have acute pancreatitis and growth retardation as well.